Hey, what's up everybody, and welcome back to The Sanctuary. I'm your host, Professor C, and today we're going to be doing some more A&P. Specifically, we're going to do the knee joint, things like ACL, MCL, and some of those terms you might have heard before. So, let's check it out. Alright, let's start off with looking at the patella. So I'm going to sketch in a little patella here. I don't need it to be perfect, but I'll get rid of it in a minute so we don't obscure some of the things behind it. So the first thing I want to do is show you the quadriceps tendon, and that would go somewhere about here from the top of the patella up here to the muscles that are on the femur. And those muscles that are there on the front of the femur are your quads, your quadriceps muscle. So all four of those quadriceps muscles will play some role in forming this quadriceps tendon. Now, tendon is a good word that describes something that connects a muscle to a bone, so it is named appropriately. Now, underneath, I should say, on the superior or the inferior aspect of the patella, when you look at the apex of the patella, it will connect with a different type of structure down to a lump on the front of the tibia known as the tibial tuberosity. Now, this structure is called a patellar tendon, even though it's misnamed. That's why I have a star here. Notice that if you look at the details, this structure is connecting bone to bone. It's going from the apex of the patella to the tibial tuberosity. So it should technically be called a patellar ligament. And sometimes it is in literature, so don't be fooled. It's not a different structure. Patellar tendon and patellar ligament are interchangeable, although technically it's a ligament. Okay, so in the next picture, I want to remove the patella and show you the structures that lie underneath it. The first structure that I want to show on this image, remember we're taking the patella off, so it's been removed, is called a lateral meniscus. So meniscus is a Greek word for a moon or a crescent. In Latin, they use the root lun or luna to refer to the moon. In Greek, they use men or mens or something close to that. That's where we get our word for month in English. So there should be some crescent-shaped structure like right here on the lateral part of the tibia, right on top of it like that. And that's the lateral meniscus. There'll be another one on the other side called the medial meniscus. So I can draw that very similarly just by drawing another crescent-shaped object sitting on top of the tibia. There's the medial and lateral menisci. Okay, now let's talk about some of the ones you may have heard of if you're into sports injuries and so forth. So an anterior cruciate ligament. So the idea here is it's in the front, anterior, and it's going to cross over. Cross from the word crux, to make a cross, cruciate meaning cross. So what I'm going to do is start on this side and roll it over to this side, just like that. Something, remember, we're just getting close here. There's an anterior cruciate ligament. I can put ACL next to that just so we see that a little bit better. Now, there's another one called a posterior cruciate ligament. And I don't have a pink color on hand, so I'm just going to do it in red here. It will run behind it in the opposite direction. So it will also cross over from the lateral side to the medial side. Oppositely, the way that the ACL does, there's the PCL, the posterior cruciate ligament. Okay, there's two more we need to talk about on this picture, and they're going to go on the outsides of the bone to hold basically all of the condyles together. So let's look at a lateral collateral ligament. It's a little bit repetitive there, also known as the LCL. Sometimes it is called the fibular collateral ligament because it's going to go from the head of the fibula over here to this lateral condyle of the tibia. No, sorry, of the femur. So from the head of the fibula to the lateral condyle of the femur is the lateral collateral ligament, or fibular collateral ligament. And on the other side, we have a medial collateral ligament known as an MCL. It's not a cruciate ligament. There's only an anterior and posterior cruciate. But this medial collateral ligament is kind of the same rules. We're going to go from the medial condyle of the tibia, and it will attach up here to the medial condyle of the femur, like that. So there's the MCL, medial collateral ligament. On the other side, the LCL. So there's the 6 structures you hear a lot about, minus the patellar structures that hold that knee joint together. Here's a real artist drawing of what we drew. Very similar. I think they did a better job, of course, but I think we did okay with our little sketch. Now, if you're into sports injuries or sports medicine, you may have heard of the unhappy triad. And what this is if you have a devastating knee injury, such as this football player down here, you may be out of the game for not only the rest of a particular game, but it may be out for several weeks, month, the whole season if you have these 3 injuries simultaneously. And that is doing something, pulling, stretching, tearing the MCL, medial collateral, the ACL, anterior cruciate ligament, and the medial meniscus. So that would be the ACL here, just to show you again, and the medial collateral ligament over here, and the medial meniscus. If all 3 of those were torn, ruptured, stretched in some way, we would call this an unhappy triad, and it may take months and months to fully heal from this kind of damage. Now, there are some bursae. We covered that in the last lecture, these fluid-filled sacs of synovial fluid that act as lubricating structures in knee joints, shoulder joints, and other kinds of joints that move around a lot synovially. So 4 major superficial knee bursa. The top one here is called the suprapatellar because it's above the patella. There's one that's in front of the patella, anterior to it, so that's called the prepatellar bursa. There's one underneath the patella called the infrapatellar bursa. And there's one over here. Sometimes it's referred to as the pes and serine bursa, or sometimes it's called the subsartorial bursa. Now, pes and serine is the one I've heard the most describe that, but I do see subsartorial on some texts. So there are 4 superficial knee bursa. Now, what could happen is, like in an instance of bursitis, again, itis is referring to an inflammation of one of the bursa. So say you have some sort of stretching, overstretching, damaging to this knee bursa, and it causes some inflammatory reactions around it. It's usually self-limiting, meaning that it usually will heal itself over time if you continue to not damage it more. But in chronic instances, it may become debilitating, and it may last for years and years and years. Now, this concept of water on the knee is what it's called in English and kind of colloquial terms when you hear people talking about water on the knee. It's actually called knee effusion, where synovial fluid will leak out of the bursae and into the surrounding tissue spaces, and then it starts to swell up, and it impairs the way that you move that joint, you can imagine. So if the swelling does not self-limit, if it doesn't heal itself or go away on its own, it may need to be treated, and this may be a regular type of treatment, lancing, to drain that tissue of that extra fluid that's sitting around there. 1, you don't want that pressure pushing on your joint. Number 2, you don't want all that fluid to become infected and to become some totally different kind of problem. All right, hope you enjoyed the talk on the knee. Thanks for watching it. If you did, check out some other videos in my series if you want to learn more about anatomy and physiology. See you for the next one. Bye-bye.